Welcome back to A Healthy Dose. I'm Julie Stoutland. In part one of this series, we explored what Canadians want from their healthcare system and some of the reasons why it's struggling to meet those expectations. Today, in part two, we're looking outside our borders and asking what we can learn from other countries that handle healthcare differently. Joining me again is Colin Craig of secondstreet.org, a research group that focuses on public policy decisions and the impact they have on Canadians from coast to coast. Thanks for joining us again.
Well, thanks again for having me, Julie.
So let's start with a tough question. How does Canada's healthcare model actually compare to other developed countries? Dare I ask?
Good question, because we should always be wondering how well we're doing with our peer nations. And sadly, when it comes to healthcare, we're not doing so well.
Mm.
International studies tend to find us lagging behind other developed nations, often near the bottom of the pack. Especially when you look at things like how many doctors we have per capita, how many nurses we have per capita, how many hospital beds we have per capita, how many MRIs we have per capita. So when you do those apples to apples comparisons, we're often not doing as well as our peer nations.
So what countries are doing well, or are they just doing things differently? And what can we learn from them?
Yeah, so a lot of the European countries with universal systems, they're doing quite well. We've personally been over to Sweden. They often perform better than Canada.
Mm.
Um, Countries like Australia, they do well. Japan, you look at the German model, the Swiss, and so forth. You tend to have universal systems, which is something that Canadians love the idea of. We have that here in Canada, although it's more of a universal waiting list system at the moment rather than universal healthcare.
Unfortunately.
Yeah, and we talked about this previously, but it's important to note that every day in this country in Canada, you can find people that have had positive experiences with the healthcare system,
Right.
and that's great. That's wonderful. That's what we all want. But the problem is that there's too many patients falling between the cracks. People that are waiting long periods for basic surgeries and diagnostic scans and so forth, and it's quite bad. So,
So these
good
countries
good
that
news
have
is
universal, but what else are they doing that's different from us then if they have the universal still?
Yeah, so they do. That's a very good question. They do a variety of things differently. First of all, we take a very top-down approach in this country. We have the government controlling
Mm.
so much, whereas in other countries they tend to have more of a bottom-up approach. So, for example, in Japan, uh, what the government does is they decide how much they're going to spend per procedure or service in the healthcare system. So they might decide that they're going to spend, I'll make up a number here, but let's
Okay.
say $7,000 for a knee surgery.
Hmm.
So then what would happen is that anyone can open up a health facility, and as long as you've got qualified and trained medical staff, you can open up your facility. And if you provide that knee surgery in question, well, then you're getting $7,000 from the government. It doesn't matter if it's a government facility or a non-government facility, that's the rate. And so you have a much more active healthcare system. It's more robust. And best of all, they don't have wait times. Like you can get
Mm.
it right
Yeah.
away in Japan. If you need healthcare, they refer to it sort of as like instant healthcare.
Yeah.
Whereas
Wow.
in Canada,
What is
how does it
that?
work in Canada? You find the opposite here. You have the government deciding when they're going to open up the next hospital or
Yeah.
expand one. And whenever they partner with a private provider, it's controversial, whatever.
Right.
It's a totally different approach. And
So
so if we
would you
can,
say that's the difference in the relationship between patient choice and the cost of care and access to quality of care in these other countries?
yes, it's a huge
Yeah.
difference. It's all based around the patient in those countries. Here, it's based around the government controlling things from a top down, uh, and it's more ideological. But there, the money follows the patients. The money pays for services to patients. In Canada, we have money that goes into these bureaucratic black holes, and then some of the money spits out, to make its way down to services to patients. It's the wrong way to do it. And we've seen Quebec start to change that. They've had some
Mm.
good success by starting to copy these other nations. Alberta's promised to do the same thing, so that's positive. We'll have to wait and see how things turn out there, but they've
Right.
taken a good step in the right direction. So.
Okay. Well, stay with us. Next, we'll tackle one of the most divisive questions. Is private healthcare a threat or a necessary evolution? Stay with us. We'll be right back.